A chieftain of the All Progressives Congress and consultant psychiatrist Dr. Abiola Oshodi joins me live now from Canada. Good to have you join us on TVC News at 10, Dr. Oshodi. As a Nigerian, and especially one who has had a taste of home and abroad, what's your evaluation of how Nigeria is faring after more than 6 decades of freedom from colonial rule?
Thanks for having me in the studio again, Abosede. It calls for celebration that we are 65 years old from colonial administration. While those years have been, we've experienced a lot of challenges, whether it's politically, whether it's economically, whether it's socially, but I think overall, we have fared very well as a nation, and we are inching closer to the dreams and the aspirations of our founding fathers. We're not there yet, but I think with the necessary steps of reform that the current administration has taken over the last 2 years, it gives one a lot of hope and joy that we are moving closer to our own promised land. We are far away from Egypt.
All right. Let me get your input as a medical professional, because as at April this year, the federal government reported that more than 16,000 doctors left Nigeria, in the past, in 5 years. Meanwhile, back home, we actually do not have enough doctors to attend to patients. So what practical steps do you propose be taken to correct this anomaly?
It's quite disturbing when you hear such news, even though it's not new. Way back when I was in secondary school, during the years of the Ibrahim Babangida military administration, I think Nigeria witnessed another wave of brain drain during that administration. And one of the things, or one of the innovations that administration came up with, was to create a special salary scale for doctors. With that, they were able to retain a lot of Nigerian doctors, and I think that special incentive minimized the attendance risk of leaving the country, amongst other innovations, to improve the healthcare system. I think the government needs to pay more attention to investing and also creating the opportunities for private investors to come into the health sector, to remunerate health workers substantially and create a system, that will make healthcare very, very affordable and robust. And I think we can do it. It's just a matter of political will, drive, focus, vision. And I think it also falls within the renewed hope agenda of the president. And there's a lot happening in the health sector. It might not be enough, but I think we are going in that direction.
Let's talk about Nigerians in diaspora. Definitely they contribute, a whole lot to the country's GDP. But then, as someone who falls within that category as well, what sorts of reforms are you looking forward to help these people better participate in governance back home?
For me, the number one will be substantial electoral reform that would enable diaspora to participate in the electoral process, whereby we can vote and be voted for. It's not, what's been witnessed at the moment is that a lot of diasporas are disenfranchised. Unless they are physically in Nigeria at the time of voting, they cannot. So if we have a system whereby they can vote anywhere, any part of the world, I think it will improve their confidence in the system. And the government can also get a lot of money, from the diaspora. A lot of the borrowing probably would not be necessary, because I think a lot of the infrastructure that the government is embarking on can be funded, through crowdfunding from diaspora. We have substantial number of them, across different parts of the world. And the funny thing is that, we all have a burning desire of the country in our hearts, despite the distance, collectively, and our children and grandchildren as well. That's what I witness on a daily basis when I meet Nigerians abroad. We love the country, and we pray that the country will prosper and continue to be peaceful.
APC Chieftain, consultant psychiatrist, Dr. Abiola Oshodi. Thank you very much for your time on TVC News at 10.
Thanks for having me again.
You're watching TVC News at 10. We'll be back with more stories in just a moment. Stay with us.